Okay, here I have an axial CT of the cervical spine, and we're going to focus on the supraglottic airway here. Now, this image um, centered over the superior portion of the supraglottic airway. Here you can see the epiglottis, okay, and then this airfield structure is the molecula here. Right here you can see the hyoepiglottic ligament, okay, divides the molecula, and here the left follicle is a little bit effaced. But if you look at this here, this pointed structure here is the epiglottic fold, right? This is the left epiglottic. And this forms the posterior wall of the supraglottic airway. So have a supraglottitis or an epiglottitis. It's the inflammation in the posterior wall in those epiglottic folds, which really close off the airway. And if you look at it, it should be nice and sharp. It's, this should be nice, kind of sharp triangles and predominantly fat filled here. The fat in here should be clean. Patients had radiation back, you can have some chronic edema that persists in that area. And fluid overloaded, you can have some edema there. But in general, right, that should be a normal patient. That should be nominally fat filled and it should be pointed like this. And when it becomes edematous, like in the setting of supraglottitis or epiglottitis, right, this fat will become hazy, will become infiltrated, and these triangles here will start to round off, start to become blunted. So when I look at the top image here, I think of this almost like a cobra with the mouth open, right? And these are like the two fangs. Here, the cobra. Here you can see one eye. This cobra is winking at you. Here, the one eye is closed. Here, the right eye is open, right? And here are the fangs, right, that are uh, like this. So blunted or epiglottic foot. You want to see it nice and pointed, right? If it comes blunted, fat in there, become edematous, right? You are thinking about supraglottic inflammation involving the epiglottic folds. Epiglottic folds form the anterior wall of the pericardial sinuses, right? So here you can see, as I go down a little bit further, here you can see the pericardial sinus. Another marker for inflammation is the looking at the pre-epiglottic space, right? So generally, like this space here should be predominantly fat-filled, and that fat should be clean. Okay, so that fat in the pre-epiglottic space is contiguous with the fat in the epiglottic folds. It's an infiltration of that fat, should tip you off to presence of inflammation. You can see a very small laryngosele on the right side. Okay, it's connected by a stalk to the right laryngeal ventricle. What other things can we look at here? Another important, if you're looking at a cervical spine CT, I look at this on every cervical spine CT in a trauma case, this black line. You want to see a nice, clean, black retropharyngeal fat spread. In a normal patient, right, normal, healthy patient, that should be just completely great at, should be fat density. Have edema there. If you have some hematoma, you want to look more carefully for the presence of a vertebral body fracture through an anterior osteophyte. Okay. Again, you could, if you have a patient who's in fluid overloaded state or anemic or third spacing, you can have some fat infiltration there normally, or if they've had radiation. But again, a healthy patient, that fat structure. Here you go. Right here, you can see the two fangs of a cobra, right? There's a little bit of space in between, and it should be nice and sharp, right? So if you're thinking about, right, the epiglottic folds, right, that should be nice and sharp, particularly at the top portion.